If you find someone who appears to be unconscious, is not showing any signs of responsiveness, and is not breathing, remain calm.
Wayne, are you okay? Can you open your eyes if you can hear?
Call for help, retrieve the AED, and begin CPR. Remove the AED from its carry case, switch it on, and follow the voice prompts and instructions.
Adult patient, call for medical assistance. Remove clothing from patient's chest to expose bare skin. Pull green tab to remove pads. Peel pads from liner. Apply pads to patient's bare chest, as shown in picture. Press pads firmly to patient's bare skin.
Shave hair from the patient's chest if necessary. Ensure that it is dry and all undergarments have been removed.
Assessing heart rhythm. Do not touch the patient. Analyzing. Do not touch the patient. Analyzing. No shock advised. Begin CPR.
The Samaritan 500P will analyse the effectiveness of the CPR and will instruct the rescuer whether to push harder, push faster, or push slower, based on real-time feedback.
It is safe to touch the patient. Place overlapping hands in middle of chest. Press directly down on the chest in time with metronome. Remain calm.
When performing CPR, watch and listen to the AED.
Push harder.
It will analyse the effectiveness of the compressions.
Good compressions. Push faster.
It gives feedback on the speed and depth of the compressions. These real-time prompts based on actual blood flow through the heart ensure you are performing effective CPR.
Stop CPR. Assessing heart rhythm. Do not touch the patient. Analyzing. Do not touch the patient. Stand clear of patient. Shock advised. Press the orange shock button now. Shock delivered.
The Samaritan 500P will only shock the victim if it determines that a shock is required, so there is absolutely no possibility of accidentally delivering a shock.
Begin CPR. It is safe to touch the patient.
Continue CPR until further instruction or until the emergency services arrive.
Good compressions.
Perform rescue breaths as appropriate and in accordance with your training. After using the AED, the pad pack must be replaced with a new one. Then return the AED to its original position. If you have the optional data management package, you can download the recorded event using a cable and the Saver Evo software. The Samaritan 500P. More than an AED. It's life-saving. Pure and simple.